Thanks for joining, everyone. We'll get started in just a couple minutes. We'll give it just a few more minutes to see if anyone else can pop on. Okay, let's get started. We have about 11 of us total, which is great. So good evening, all of you guys. Welcome to Managing Grief, a mind-body awareness and somatic movement exploration, brought to you by NAMI Cook County North Suburban and the Cancer Wellness Center and Richard Sims, a somatic embodiment and mindfulness educator. I'm going to pass it over to Lisa from the Cancer Wellness Center to give a brief introduction.
Hello, my name is Lisa Rodebush. I'm a program associate at the Cancer Wellness Center, and I'm so glad to see several of you here tonight. For those of you that are joining for the first time, I just would like to share a little bit more about the Cancer Wellness Center. The center was founded in 1989 as a nonprofit organization with a mission to help anyone touched by cancer find a way forward. The center was each year our free counseling services, support groups, health and nutrition programs serve over 2,000 community members of all ages and backgrounds. People with cancer, family members, friends, and caregivers all come to us to connect and cope. Our services, which are both virtual and in person, are things like education programs like the one today that aim to help you navigate the varied challenges that come with living with a cancer diagnosis. We have wellness classes like yoga, meditation, nutrition, and more that provide a holistic approach to healthy living. And then we also offer support services, including counseling for individuals, families, couples, children, and those bereaved, as well as support groups that are designed to help our participants manage the mental and emotional impact of cancer. And I will go ahead and put our website in the chat for you all to see. And I want to thank NAMI of Cook County North Suburban again for partnering with us on this program. And next, I would like to welcome Courtney from NAMI.
Thank you. So again, my name's Courtney. I'm the Adult and Family Programs Manager at NAMI. For any of you who might not know what NAMI is, we're one of the nation's largest grassroots mental health organizations that provides public awareness, no-cost support, and education programs online and in person so that people and families affected by mental health conditions can build better lives. We're a lifeline to individuals and families who do not know what to expect in their difficult life journey. We offer classes, support groups, and do a lot of advocacies for mental health. Our programs are free, and they're open to those in our community service areas. And we do not turn anyone away who is in need. So we're very pleased to have you all here tonight. This year, each month, we have mental health professionals who will dig deep into a variety of topics to further educate us on our community members' topics of interest. So this workshop will explore grief and how this often experienced emotion arises during cancer and other chronic illnesses, whether you're a patient, caregiver, or someone who's lost a loved one. Through a somatic lens, we'll examine how the mind influences the body and vice versa. We'll discuss how grief shows up in our bodies, affecting how we feel both physically and emotionally, and how we cope. We will also learn practical body-mind approaches that are designed to be used throughout your day, including gentle movements, body awareness techniques, breathing, meditation, embodiment, the principles of aikido, mindfulness, and more. Just some statistics that I found online um, from the Los Angeles Outpatient Center. 88% and 64% of grievers experienced emotional and physical symptoms of grief. 75% of individuals diagnosed with prolonged grief disorder had at least one comorbid psychiatric condition, with major depression being the most common. 20 to 50% of individuals who undergo treatment for a grief disorder reported experiencing suicidal thoughts. So it's apparent that grief can have a profound impact on your mental health and can present itself emotionally and physically. Um, our Q&A will be held at the end of the presentation, but if you want to type in questions in the Q&A box during our conversation, you're more than welcome to. So our guest speaker tonight is Richard Sims. He has studied somatic education and embodiment for 35 years and holds the credentials of Master of Somatic Movement Educator and Master Somatic Movement Therapist. That's very, very cool. Richard serves as a facilitator with Men Healing, which is a group dedicated to helping male identified survivors of sexual trauma, which also offers private classes and sessions for individuals with organizations like the Cancer Wellness Center. Rich serves as president of the board and on the executive committee of the International Somatic Movement Education and Therapy Association. So we're very excited to have him here tonight to further educate us on this ever important topic. So I'm honored to welcome our guest, Richard Sims.
Well, thank you,
Please.
Courtney. So thank you. Thank you, Courtney. Thank you, Lisa. And thank you, everybody that has shown up to participate tonight. So just I want to do a quick slide presentation, and it'll be sort of the boring slide presentation. Then we'll get off of that, and then we're going to play. Okay, so just to quickly describe my connection to cancer wellness and cancer, it goes back to many, many years ago. The first encounter we had with cancer was with my wife, and she was just doing a self-check and found a lump. And that led to, oh, the lump's just not a lump. And when she started talking to everyone and the doctors, we went through that. And we had 2 little kids at the time, and we still have 2 boys, but they're now grown a bit. And that led to, oh, this is not the greatest thing in the world. And she turned out to be BRCA positive and asked the doctor, so it's in one breast. What are the chances? And he reported back, well, because of your ancestry, because of all of this thing, 85%. And she said, done. Let's just take care of this right now. So went through double mastectomy. And just so everybody knows, everybody that I'm going to be talking about tonight knows and appreciates the fact that their story is being told as long as it can help others. So sometimes people ask me that because I tell people about our experiences, which I think is important to share with others. So long story short, we went through that. The kids kind of saw, their mom going through this whole experience of cancer, and we got a lot of different help from people along the way. And about a year or 2 after that, my oldest son walked in and said, hey, Dad, I have a stomach ache. And we said, okay, what'd you eat? Or what's going on? And that led to the next day him going, Dad, the stomach's really getting bad. And we're like, okay. So we called our buddy who was his pediatrician. And that led to the next day, Sunday, where, his doctor said, hey, if it's getting as bad as you guys think, let's bring him in. I'll just open the office up and come on in and we'll get it checked out. So we got there, and long story short, we ran some tests and everything, and he came walking in and said, get your son in the car and drive as fast as you can to the hospital. The ER is waiting. And by the time I got there, he was jaundice, and we didn't know what was going on. The hospital, knowing our history with my wife's cancer, finally, a couple of weeks later, tracked it down and said, hey, we know it's not this. We know it's not liver failure. We know it's not XYZ. By the time we got to the last person in the line, they looked at me and said, but we do know that he has leukemia. And that led on a couple of years journey, which ended in complete bone marrow transplant. And he is now 22 and almost graduating from college. And anybody that knows him, like that didn't know him then, would never know the things that he went through. And just because I got a little jealous, I always laugh at them because they went through these big things. Down the road, I got a little skin cancer and had to take that off. So that's my little morbid sense of humor, just because I want to be a part of the crowd. So that's the really short, condensed view of my connection to cancer and cancer wellness. A lot of people helped us along the way. And I still to this day like to kind of give back and talk about different things that we went through as a family and that I've helped a lot of people with along the way as they make their way through their own journeys. So, jumping in, let me share my screen here with you. We're going to cover a couple of things, like I said, and then we're going to have some fun, believe it or not, talking about grief. Okay, so managing grief, a mind-body awareness and somatic movement exploration. So since I said that, somatic movement exploration, I think it's important to understand what in the world that means. Okay. Somatics and the word somatic has grown to mean a lot of different things to a lot of different people. So I like to kind of nail it down to what it means to me in my practice and everything, because there are a lot of different somatic practitioners. Pretty simply, somatics to me is the in-depth study of the self from your lived experience and how the intentional, coordinated awareness and use of the body, mind, and spirit, however you define that, whether it's religion, whether it's spirituality, whether it's that special spark that makes you a human being, I don't care. Whatever that means to you, you're going to use that along the way here for the betterment of an individual and the groups in which they live. Soma means in ancient Greek, the body. A gentleman by the name of Thomas Hanna coined somatics to kind of travel down this path. Okay, for us doing something somatically would mean to consciously and intentionally use your body, mind, and spirit together to gain information and skills that will help you in the active pursuit of your needs, hopes, goals, dreams, and desires. We all want to lead good, loving lives, and I wish that on everyone else. And I believe that's what everybody would like. And if we could all kind of help each other along the way, that might, be an easier task. Okay. But that kind of also plays into what we're talking about tonight with grief. Sometimes that gets in the way. Okay. So during the workshop, we're going to experience some of the things that I do with people. And we're going to kind of play. And graciously, Lisa and Courtney have agreed to play along with me. But I would also like to have everybody at home also play along, because it's important, if we're using our mind, body, and spirit together, to use your mind, body, and spirit and not just sit here and talk about things. Okay, that's one approach, but we're kind of leaving things behind. Okay, so before we jump in, I always do this. I have a safety contract with everybody that I work with. The safety contract says that you are in charge. I'm a somatic educator. I can teach things a million different ways. Okay, but I like to tell everybody there's no way that I can know everything that everybody has gone through and experienced. So you're in charge. Okay, if you want to participate, participate. If I ask you to raise a hand and that doesn't feel right, don't raise your hand. Okay. But what I ask you to do is possibly, in this case, look at what Lisa and Courtney and myself are doing, because you can learn just by watching what others are doing. Okay. So that's my safety contract with you. Cool. let's move on. One quick thing. Let's do a little exercise here just to get us warmed up here. So let's see. I'm going to unshare my screen so I can see everyone nice and large. Okay. So Lisa and Courtney, you ready to jump in? Sort of, kind of. Okay. So what I'd like you to do is just pick an arm, any arm, doesn't matter, and just kind of hang it down loosely. Okay. And what I'd like you to do is just point it up to the ceiling. Okay. And bring it down. And if you would, just point it up to the ceiling again. Okay. And bring it on down. Just because 3 is a cool number. And let's do it one more time. Up to the ceiling. Okay. And bring it down. Okay. So we're going to be playing and doing experiments today. Okay. So this is our first experiment. Let's call that our control of our experiment, right? The thing we're going to compare something else to. Okay. So we're going to do this a little differently. Okay. And whatever this word means to you, I'd like you to lift your arm with intention. So lift your arm with intention. Whenever you're ready, I'm not going to do it. Okay. And after you lift it, bring it down with intention. Okay, do it again when you're ready. And bring it down. And again, because I like that number, 3 times. And bring it down. Okay. Was lifting your arm with intention different than just lifting your arm?
Very.
How would you describe, what's the difference?
It was slower.
Okay, it was slower.
And you can feel the movement of it more than just flinging it up and down.
Yeah. Yeah. Excellent. How about you, Courtney?
Yeah, it felt more in my control. Um, or I was paying more attention to it, maybe.
Excellent. Okay. So I love doing this exercise just to start getting people in touch with their bodies, in touch with what they're doing, noticing things that we usually don't notice. There's another reason that I do this. Okay. What we just did, we just basically played from a body sense of 2 different methods of thinking and learning. Okay. So the first time I just gave you a goal, I just asked you to point up to the ceiling, right? Okay. That's goal-oriented thinking. I gave you a goal, boom. I just go up to the goal. I got my goal. It's like driving to the gas station or driving to the grocery store or something we've done a million times. Okay. Second one, when I just dropped the word intention, was process-oriented thinking. Okay. And you were both able to all of a sudden pay a lot of attention to, oh, I was moving slower. I actually felt what I was doing there. Okay. What I invite everybody, even those watching from home, is to stay in this process-oriented thinking mode throughout this workshop. Okay. Because somatics is something that you got to experience. We can't just talk about it and think it through and think we're going to figure it out. We actually need people to feel it and experience thing, experience lifting of the arm. You don't want to just lift the arm. Okay. We're looking for changes. We're looking for, what's actually going on here. Okay. So I have a quick question for either of you. Grief is an emotion, right? What's an emotion? Not the name, but what's an emotion exactly? We all talk about this all the time, but how would you define what an emotion actually is like? There's an emotion.
Something that you can feel inside your body.
Okay, something that you can feel inside your body. And what else pops to mind?
It's usually a state of
Yeah.
It's weird.
state of good or bad feeling, but it's a different state than normal.
Okay. Okay. So you've mentioned it's something you can feel in your body in a different state. Is a feeling different than an emotion? And I'm not putting either Courtney or Lisa on the spot. This is something I do with everybody because if we're talking about emotions, let's all find out what, because I'm about to give you a different definition than most people, but it helps in the work that we're doing. But is a feeling different than an emotion?
Maybe.
Maybe.
Yeah.
Okay. So let me share what I think a feeling and an emotion is. And I'll share my screen again just so it's easier for people to see this sometimes. An emotion to me are the physical actions that we carry out in our bodies. Okay. So if you get nervous, you may like tense up or you may pull back. But they're the emotional actions that you're actually doing with your physical body. I split those from feelings, and I define feelings as what we experience when we're physically doing these things in our bodies. Okay. It'll make more sense as the workshop goes on. Okay. But it's an attempt to basically, um, you know, get in concrete, like something to work with, as opposed to these mysterious emotional things that we talk about, or these feelings. Okay. So emotions are the physical actions that we carry out in our bodies, the physical things. Feelings are the experience of what we're carrying out. Okay. Eventually, when people start thinking about, they go, well, which one causes which? And it's a neither thing. They're all going on. Okay. We're doing emotions, we're having feelings, we're experiencing them. There wasn't like an egg or a chicken from the time we started breathing. This is all going on at the same time. Okay. And it doesn't matter which happened first, because really we need to be concentrating to what's happening right now. Okay. That's when we can make some changes and that sort of stuff. Okay. So why do we care about that? Okay, we care about that because I'm basically looking for that way in, as opposed to just kind of talking about it or just kind of teaching people, hey, you do this in your body. How can we get in and then intentionally change things to change how we're experiencing whatever we're experiencing? In this case, we're talking about grief, right? The emotion of grief. Now, while I'm defining things here, let me click over and talk about grief for a second. As soon as my screen stops jumping around. Well, huh. Well, I am not going to share my screen. I am going to just tell you this because it's jumping all over the place and I don't know why. So let me just stop this for a second and I'll stop the share and then we will continue on because my whole screen is really going a bit crazy right now. Okay, so, well, this is interesting. Sorry about this, everyone. Screen disappeared, but I'm going to get it back. And if I don't, we're going to jump into playing and everything else, because that's the important stuff.
Or if you need to email it to me, I can share my screen.
Let's see here. We don't need to share it. I just wanted to share a couple of screens, but let's see here. Why won't that? Let's just quit this and open it up again, and we will go for this one more time. Okay. There we go. Knew we could get it. Okay. Move that over there. And we'll move this over here. And we'll get to the little grief part. Okay, well, I am just going to not share. Oh, it's working now. Don't ask me why, but let me see. Hang on. What are you guys seeing? Anything right now? Nothing, right?
No, we were for a second, but now it went
Okay.
away.
Yeah, you had it on for a second.
There
There
we
we
go.
go. Now it's
Oh,
back.
it just, okay. Let's read this quick and then we'll get out of this program that's going crazy. So, grief, a simple definition for a big term. Let's define grief simply as the emotional and physical anguish, pain, and overwhelm that may be experienced after a significant loss. Okay. So there's a lot of different definitions out there, but let's simplify it down. Okay. The emotional and physical anguish, pain, or overwhelm that may be experienced after a significant loss. Okay. There's no one loss that causes a person to experience grief. Okay. We're talking about things that people experience around cancer and everything like that. But it really can be anything. And there's no way to like measure somebody's grief. And there's no one way to really do grief. You know, people used to talk about the 5 stages of grief. And even Kubler-Ross came out towards the latter part of her life going, I really hate what this has turned into. Like, you know, it was not meant for it to be this all-encompassing, stiff, static thing. And everybody knows somehow around the globe about these 5 stages. And a lot of the people that I work with feel sort of uneasy when they don't think they're doing their grief right. Okay. And it's just not the way grief exists. You know, here, a death of a loved one, cancer diagnosis, loss of something. It can even be just, I just lost my job. Okay. But that my job was really an important part of my life. And I can mourn the loss of whatever. Okay. So just wanted to say that. Let's start jumping in. Okay. And let's start having fun. So, um, one of the things that plays in that a lot of people don't talk about when we're talking about grief is our distress responses. Okay, so fight, flight, freeze, fawn, flop, if you want to start with the F's, stay, make them all F's. Um, so a lot of times, you know, people that I'm working with don't really even understand that. If I start telling about it, they go, oh, okay, that's kind of cool. Um, but how do you work with that? Okay. So I came up with some different exercises because I don't want to dive into the deep end of grief and I don't want to dive into all this other stuff. We want to help people sort of, you know, stabilize and be in a good place so they can talk about their experience of how this is playing out for them. Okay. But if they're so knocked off balance because of, you know, a million different things that can happen to them, how do you talk about any of this stuff? Okay. So I had to come up with an exercise where we could play with distress responses. This is something I do a lot with people without diving into something distressing in terms of emotionally, you know, disturbing thing that's going on in people's lives. So, Lisa and Courtney, are you ready to play some more?
Mhm. Yeah.
Ready?
All I need you to do is pay attention to what you're doing in your body. Because remember, we do emotions in our body and then we have certain experiences. So what I came up with was this game called Balloon Attack. Okay. Because balloons are ferocious, especially blue balloons. So, what can I do with a balloon? Okay. So, do a couple of things. You tell me if you got anything going on and you're doing anything in your body. So, since it's called balloon attack, if I attack the balloon, probably not a lot going on inside your body, right? Maybe, I don't know, but usually not. If the balloon attacked me, still probably not a lot going on there.
Making me laugh.
Yeah. Okay. So you're doing laughter. You're doing
Oh,
fun, right? Okay. But we don't want to do fun. We want to play with something else. So what I did was I came up with the balloon's mortal enemy, a big scissor. Okay. And what I also happen to have here, as opposed to the scissors, since we're on Zoom, is I happen to have a microphone that I can bring right into Now, do either of you have any hearing problems or anything like that? Okay, good. If anybody at home has any hearing problems, turn the volume down a little bit or whatever you have to do, or but it'll be okay. Okay. So I'm going to give you a warning. I go 3, 2, 1, and I'm going to come in and you tell me what you're doing with your bodies. Okay. Okay. Ready? Get this nice and close. Okay. Ready? 3, 2, 1, go. So what were you doing in your body leading up to what just happened? What were some
Sensing,
tensing, right?
Tensing
preparing
in the
for it.
chest.
Yeah.
Right. Right. You're preparing yourself, your body, and you didn't have to think about that, right? You just automatically, those are distress responses kicking in. Okay. How do the balloon's going to pop in my face here. Okay. So how do we not let our distress responses, if those are at play also with grief? Okay. Because, and this whole kind of subject matter came out of a class at Cancer Wellness where we were doing something. And I was asked, we were doing a whole thing on pain, physical pain. And somebody came up with the question if I thought the pain that a lot of people experience, the physical pain of grief, was the same as the pain that somebody feels when they break their arm or the finger. And I said, as a matter of fact, because of the experiences with my family, I happen to have studied a lot about pain. And the actual mechanisms are actually at play in both of those. So even though grief is an emotional thing, it causes the same types of physical pain, the same experience of pain or loss that some people might say, I hurt in my heart. It's actually real pain. It's not, quote, psychosomatic, made up in the mind pain. That's a whole workshop in itself. So we won't dive in, but these are the things that, like, not only does pain fire off, but our distress responses are firing off too. We don't usually think about that happening when we're talking about something like grief. Okay. So let's play with this because our distress responses are there to protect us. How do we let them do their thing, but how do we not get stuck? Because that's when they become problematic, when we can't get out of our distress responses. Okay. When we can't help if we're dealing with something that's pretty traumatic. Okay. So what I'd like you to do, whatever this means to you, okay, and the one caveat with that is if you practice yoga or any special forms of breathing, don't do that because that's not how life works, right? We're not like doing a bunch of stuff and then we were all prepared. Okay. So whatever this means to you, just let your tongue relax in your mouth. So just down it, don't stick it up to the roof because somebody told you it's got to be behind the teeth. Just let your tongue relax in your mouth. As it relaxes in your mouth, see if by relaxing your tongue, that helps you relax your jaw. And if your tongue can help relax your jaw, can you then take that relaxation down into your neck? Okay, and remember, it's just starting with our tongue down into our jaw and our neck. And see if you can bring that same relaxation down into your chest and your upper back. Remember, this is the first time you're trying it, but it all started with your tongue, your jaw down into your neck, and your chest and your upper back, and down into your core. And see if your stomach can actually move while you breathe. And remember, it all started by just relaxing your tongue. Okay, so that's our body. Let's bring a little mind into this. I'd like you to think of someone that you care for greatly or that cares for you greatly. Or maybe it's a place that just makes you feel whole or an activity that just makes you you. Okay. I'd like you to think about that person or the place or the thing while you're relaxing your tongue all the way down to your core. Now, does each one of you know what a lightning bug, a firefly is? Okay. Has anybody ever asked you to be a firefly's butt before? Like the butt of a firefly, like their tail end? No, I've never had
Mhm.
anybody go, yes, I've been asked to do that. Okay. But I like to ask because it draws your attention right to the area that I'm looking for. What does a firefly's tail end do? It, it,
Lights up.
it lights up.
Yeah.
Okay. Now, the cool thing about your brain and your body is even though I might ask somebody to do something that's impossible, our brain and our body actually tries to do it without us knowing about it. So, what I'd like you to do while your tongue's relaxed and you're thinking about that person or that place is imagine every inch of your skin is made out of that bioluminescent stuff that a firefly has. And I want you actually to shine out to the left, to the right, forward, backward, up, and down. And not just shine out, but through the walls all around you. Okay? The relaxed tongue, all the way down to your core, thinking about that person or that place, and shining out in all directions. While you're doing that, we're going to do this again. Relax your tongue and shine. And three, two, one. So is that a different experience? How? How's the
Chest
experience?
didn't tense. The chest didn't tense.
Mm-hmm.
There was no huge like tension and release. Before it was like this, up and then down.
Mm-hmm. How about you, Courtney?
Yeah, I didn't feel, yeah, I wasn't scared of whatever was about to happen. I already felt like at peace.
Okay. So here's what we're doing here. And before we do that, um, I always like to ask this question. Did I ever say I was going to pop a balloon? Never said it. Okay. Did you happen to notice your breathing changed while we were doing that the first time and the second time?
Mhm.
Yeah.
Yep, for sure.
How much did it change the first time? I've had people tell me, a lot of people tell me they were literally holding their breath if they paid attention to it. Okay. Now, I intentionally do this as just a way for people to play because I laid breadcrumbs all over the place, right? I asked if your hearing was okay, the mortal enemy. I put a big microphone down, as asked if you had a hearing problem. Okay. But that's how we kind of do life. We kind of project ahead, and we also, that's kind of how we do grief. We kind of project what's going on down the road and how our lives are going to be without this person or this thing. And we just react. Okay. How can we actually get ourselves into a state where we can respond instead of reacting? Okay. We just played with it. We just played with it in a way that we weren't just thinking about it. I didn't talk about a bunch of theories and I didn't talk about specifically a bunch of different things, but I had you do the exact opposite things that a majority of us do when we're stressed, when we're anxious, when we're fearful. There's a word that we dub called smallifying. It's like we actually tense our muscles, we pull back, we try to run away, we try to get away from it. We make ourselves small. Even sometimes when people go, no, 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 I get big. And I tap themselves and I was like, you're big, but all your muscles are contracted. Making yourself smaller. Okay. And when we make ourselves smaller, remember, this is mind body, top down, bottom up. Okay. Our mind sending signals down to our body, but always, even though we don't not paying attention to them most of the time, our body's sending all of these signals up to our brain, going, hey, am I good? Am I not so good? Like, should I be afraid of something? Like, am I centered? Am I grounded? Or am I like freaking out here? What's going on? Okay. Through a nice little game, I just basically walked you guys into this state that most people experience as calm and centering, a place that they can respond from. Okay. So I'm not suggesting everybody has to do the whole balloon thing, but I do this in front of people so they can see and actually experience like how much this can change something. Okay. when you're working with somebody or you're just trying at home, all you really have to remember is relax my tongue all the way down to my core. Okay. Think of that person, okay, that cares for me or that I care for, that place or that thing. Remember the lightning bug and shine. Okay. You're actually making yourself bigger by trying to shine out. Like it's it's impossible to shine out, but it's not. You're actually like doing something with your body. And it's sending signals up to your brain going, no, 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 I'm pretty cool right now. Okay. If you're by yourself, that's sending signals up to, okay, hang on, I just got to think this through about what am I doing right now. If you're somebody that's helping somebody, if you're a mental health, practitioner or any support, or even somebody that is a caregiver in a family, this is something you can show people so then they are able to talk about things a little deeper because they're in a better spot to actually talk and be in a centered space. So this is just one of the exercises, but I want to show this to people because it's pretty simple and it helps people just kind of ease in to be able to kind of recognize what's happening. Okay. So next quick game here. Okay. Could one of you or either of you describe the room around you? Pretend I can't see it. How would you describe the room you're in? Just give me a couple of things. Like, how would I know that I'm in the room that you're in?
So I'm in my office that is very happy because I love the colorful artwork on the walls and different colored pillows. And I think the whole atmosphere in my office just makes me happy. I sit next to a window with the bird feeder. The birds come up and eat the bird food all the time. My
Okay.
animals come and lay on the couch behind me. Currently, my cat's back there.
Okay.
So it is a nice, cheerful place.
So a cheerful place. Okay. So you were talking about the emotional part of your room, right? A lot.
Mhm.
And you gave me a couple of things that I would be able to find the room if you weren't there, right?
Sure.
So what we're working on now is just how do we know where we're at? But I want to separate us from a little bit of the emotional side first, and then we'll dive in and we'll go. Okay. So you gave me a couple of things that weren't the emotional side, right? You kind of talked about the walls.
Yep. The walls are blue. There's colorful artwork on the wall. There's a
Yeah.
gray sofa behind me.
Yep.
There's a big closet painted white, a taller window that from your angle might look like I'm in a basement, but it's really not. It's just a
Right.
taller,
Okay.
wide horizontal window. Hardwood floors, a white corner desk, window overlooking the backyard.
Okay. Now, and I want everybody at home to also be doing this. So check out your surroundings. Okay. Now, my question is, how do you know that? How did you know everything you just told me?
Because of my eyes.
Because of your eyes,
Mhm.
right? Okay. And that's what most of us go through life kind of defaulting to because we're human beings. And no matter how many people I've done this with, 99% tell me everything about their eyes. Okay. That's our primary sense for most people, unless there's a problem with their eyes. Okay. I'd like to invite another way of being in a room. Okay. So that's our eyes. And if something loud happens, somebody might say, okay, there was a weird noise there. Okay. But we have all these different senses, right? We have five big ones. Some people say we have 6, 7, 8. Some people say we have 60. We're not talking about those. 5. Okay. So sight is easy. We're real good at that. Okay. Sound. Okay. What do you hear in the room? Okay. And I just want everybody to do this. Okay. What do you smell in your room? Does your room have a certain smell to it? Touch. We're all touching something in our rooms. We're sitting on a seat. We're touching our clothes. The temperature, it's a certain touch. Okay. And taste, that's an odd one for a room. You could go lick a wall, but I don't do that. Okay. But have you ever walked into the kitchen and you like literally like if somebody's cooking your favorite meal, you taste the air. It's like you taste the room. Okay. Sometimes rooms have a taste. We don't think of it that way. Okay. So I want you just to take a moment and be in your room, and you don't have to tell me about it, but be in your room using as many of your senses as you can. Okay. Is that a different experience than you would normally have if you were just in a room when you just walk in? How is that different? It's the experience. How's the experience different when you're using all your senses for something? It's hard to put into words a lot of this stuff. That's why it's okay. But that's what I like people to explore because it's a different experience. Okay. I want people to be able to experience and fully experience things.
Well, I was more aware of what my clothes smell like,
Uh-huh.
what the temperature in the room is,
Yep.
what I'm touching with my hands or where my elbows are resting, the
Yeah.
sound of the water running next to me from the bathroom somebody's using. Like, yeah.
Yeah. Okay. So you're more there. You're
Hmm.
more present in the moment, right? Okay. We want to be in the present moment because that's really the only time we can do anything, right? The future, we can't teleport into the future, right? The past's already happened. We can't do anything about that. I wish I could for a lot of people. Can't. Okay. Only time we can do things is in the present moment. Okay. But how do we actually get in the present moment? So again, we can respond to things instead of reacting to them and get lost in like what we're talking about, get lost in the grief of what's the rest of my life going to be like? What's this going to be like? How am I ever going to do this without that person? How am I ever going to be able to do that because cancer took this away from me? Right? Have to be in the present moment. How do we get there? Okay. So that's the room around us. Now, I suggested we do emotions in our bodies, right? What are you doing in your body right now? So I'm rubbing my two hands right now. Okay. What are you doing in your body right now? Courtney, you want to take this one?
Sure.
Okay. So give me some things that you're doing in your body.
Um, I'm sitting crisscross applesauce, holding my hands together. I'm a little tense.
Oh,
Um, yeah, that's kind of what
cool.
I'm feeling.
Okay. Remember the tongue, Courtney,
Yeah.
all the way down. How do you know that? How do you know you were sitting crisscross applesauce and holding your hands? How do we actually know what we're doing?
You could feel it.
You can feel it,
Yeah.
right? Okay, good. It's our senses. We A lot of people go, well, I just know because I'm thinking about it, and I know. I
Mhm.
know because it's in my body, and I get to know because I'm thinking that. Well, small secret, I can think anything, right? I can think I can fly. That doesn't mean I can fly unless I would go buy an airline ticket and I can fly. I can figure it out. Okay. But how do we actually know what we're doing in the present? Okay. It's the same things. We can use our senses. Okay. So let's just explore this for a second. Sight, we can use sight, right? We know how we move and everything. Um, Sound. Okay. We don't usually think of monitoring ourselves with hearing, but just lick around your mouth. Can you hear that? Okay. Just roll your head around now that we're paying attention. Can you hear little like cricks and cracks and everything? When you get hungry, you feel it, but do you sometimes hear like, okay? So we don't think about the fact that we're monitoring these things, but we are. Subconsciously, we're okay. Sight, sound, smell. We all smell, right? Sometimes good, sometimes bad. Okay. We smell, and it changes with our emotions. Okay. If we get nervous, we perspire a little more, right? That might alter our smell. Some people say we actually pick up on this, like there are studies on pheromones, why we're attracted, not attracted to different people that were done. Some people extend that and go, no, I think we're not as acute as other animals like dogs at smelling fear or pain or any of that stuff, but we're actually monitoring all of this stuff and it's sending signals up to our brain. Okay, so smell. Okay, touch. We self-soothe all the time. Courtney, you were holding your hands. I rub my fingers a lot of times. I just go like that. It feels good.
Mhm.
I noticed on Zoom, if I'm in meetings, I go like this a lot. It just feels good. And I never really paid attention. I knew I kind of did it, but until, COVID and everything else, we were looking at ourselves all the time. I was like, wow, I do that a lot. Apparently that feels good. It's okay to touch yourself. We self-soothe. Okay. So sight, sound, smell, touch, taste. Have you ever tasted your mouth? Do your gums taste different than your teeth? Okay. It's just interesting to be aware of all these things. Okay. So be aware of yourself, what you're doing in your body just for a second or two here, but try to use as many of your senses as you can to actually be aware of what you're doing in your body. Okay, real quick, is that different to be aware of your body in this way, using as many of your senses as you can, as opposed to how you just, I'm just here.
It's calming.
Yeah, yeah. It's just calming. Okay, now hang on, let's play with this a little bit. So be aware of yourself. Now shift, don't worry about yourself, all your senses to the room around you. Now shift back away from the room to everything about yourself. Use all your senses, or as many as is comfortable, to be aware of what you're doing in your body. And one more time, shift back to the room, like we did before. Okay. Now shift back to yourself. Okay, now what I'd like you to do is imagine a sphere around yourself. So you're very aware of everything you're doing in your own body using all your senses. And instead of shifting out to the room, what I'd like you to do is grow the sphere out to include the room. So you're in the center, you're aware of yourself, and you're aware of the room around you. See if you can grow your awareness out. So you're at the center, and you're also just as aware of the room around you. Okay, how is that? Is it different to be aware of yourself or something else versus yourself at the center and the other things around you?
It is more challenging.
It is more challenging. Okay.
Pay attention to what's going on with me and then also the room.
Yes.
And then it's even more challenging to expand past the room I'm in.
Yes. Okay. So this is the challenge now. Okay. It'll come. Okay. Courtney, how did you experience it?
It was challenging, but I think it helped me feel like it was all one.
Yeah. Okay. Let's bring this into a personal level. Just we're practicing dual awareness is the official term of what we're practicing. Okay. Which is tricky because especially if nobody's ever done this before, the three of us probably have heard of this term. If you're just somebody on the street and you go, oh, dual awareness, they're like, okay, thank you. Okay. So let's bring this down on a personal level before we open it up for some questions. Okay. Because when you're going through grief, one of the things that happens is you sort of lose touch not only with yourself sometimes, but you also lose track of the ability to be in contact with others or other things. We sort of shut down and we smallify to a point that we forget how to actually connect with people. Okay. So let's practice that from a somatic standpoint. Okay. So what I'd like you to do is bring all your awareness right here to my nose. Okay. My goofy nose. Okay. Now that you know how to be aware, just bring all your awareness to my nose. Okay. And now shift back to your own nose. So you don't care about my nose anymore. You're just shifting all your awareness back to your own nose, however you would do that. And now shift back to my nose. You're not worried about your own nose. You're just paying attention to me over here, yabbering away. And bring all your awareness back to your own nose and yourself. Okay, is that different to pay attention to me versus you? It's a different experience to pay attention to yourself versus somebody else. Okay, so let's keep playing with this now that you're recognizing the difference. Let's go back to your own nose and your own self. And shift back to me one more time. And now shift back to yourself. Okay. And imagine that sphere again and grow the sphere out so you're aware of yourself as a person, but you're also expanding your awareness out to include me. So it's not you or me, but it's you and me. If you want, you can also just drift up and look at each other, but it's you and another person. So is that a different experience to be aware of yourself or to somebody else versus yourself and somebody else? We're exploring. So there again, there's no exact right or wrong. Or so Courtney, you're nodding your head. What's the experience like? What's the difference?
Um, I think it was challenging in different ways. Challenging to look at myself because just our own opinions of ourselves, looking at ourselves for a certain period of time. But then trying to include two people in one sort of awareness was challenging just to like wrap your head around to try to be aware of. But
Yep.
it got rid of that like self-awareness-ish type.
Mhm. Yeah. Lisa, what was your experience like?
Yeah, so when I'm staring at my own nose, I'm very critical. When I'm staring at your nose, I don't really care, right? And I'm not thinking, oh, it's too big, it's too small. And then when you try and include the whole group, you lose the criticism of yourself, I
Yeah.
think.
Yeah. Okay. You're with others. Okay.
Mhm.
Another exercise that I do with people, because this is weird. We're staring at each other's noses and everything else, but I do it so we can play, right? But for somebody that finds this a little difficult and on how to be things, I tell them to practice it with inanimate objects. Okay. So you can do this with a plant, believe it or not. A lot of people enjoy doing this with a cup of coffee in the morning or a cup of tea. So completely with the cup of tea or a cup of coffee, using all your senses. Then you're bringing it back to yourself and you're paying attention to yourself. Then you shift back and forth a couple of times. Then you stay with yourself. Then you extend the awareness with all your senses to the coffee or the tea. And once you're both there, then you drink your coffee or your tea. And it's a whole different grounding experience to actually be able to taste and smell and hear the sip and all of the stuff. But it really grounds you in the present moment.
Grounding, that's the perfect word.
Yeah, that's what we're after is how do we ground if when we're dealing with difficult emotions, how can we ground ourselves? How can we take the in meditation circles, people complain they're like, I can't, or in mindfulness, I can't calm my mind. It's impossible. We can calm it, but there's an expression, the Pali word I forget, but the translation is monkey mind, right? Our mind jumps from branch to branch to branch to branch to branch to branch. And how do we slow that? Okay. Well, we're slowing the monkey by giving him all of this information, this sensory information, you know, to enjoy while he's sitting on his branch and we're enjoying the cub. Okay. The room and the another thing is if you go for a walk, be aware of your surroundings in nature. Maybe you walk a block that way. Then you bring it back to yourself and maybe walk a block being aware of yourself. You switch back and forth a couple of times. Then you're with yourself and what's around you. Okay. And it brings you really grounded to not only what's going on, but also helps ground what's going on in your mind to the present moment of what's actually happening right now. Where am I? Okay. So those are a few of the exercises that I like people to experience things. Okay. And how can we work with people and not really dive into all of the things that are racing through our minds and all of the things we're afraid that could possibly happen, or that's happened the last time we went through this experience. And we absolutely know it's going to happen because that's how it happened last time. How do we escape that and stay in the present so we can talk about all the different possibilities? Or you can open yourself up to the choices that you have because a lot of times, especially with grief, we don't see there's a choice because something just happened to us. How do we just not let that take over? How do we get our choice back? And how do we decide, okay, this is how I want to move forward. And I either I'm ready to share with people, or guess what? I'm going to take ownership of this. And I'm not ready to share with anybody right now. And that's fine with me because there is no right way to do grief. We all have to make our way through. There's no, this is going to take 6 months. This is going to take years. This is going to take whatever. Sometimes years down the road, you might never think of this thing again. And then all of a sudden something happens, and it's happened to me. I've been driving down the highway and a certain smell or a certain song comes on, and all of a sudden I feel a tear coming on. And I'm like, and I'm back. I'm back. And then you go through some exercises and you're fine, and we want to be able to live and experience life. We don't want to turn something off or numb it out. Okay. But we want to do it in a good way so we can move forward and get, like I said at the beginning of this, attain those hopes, needs, wants, desires, and be able to share those with ourselves and others. So plenty more to play with, but let's open this up to any questions that people have and go from there, see where this goes.
Yeah, if any of you have questions, please feel free to hit the Q&A button, and I can read them aloud.
And if there aren't questions, we can continue to play, but let's give people a chance to play here. I'm going to call something possibly up.
I don't believe anybody doesn't have any questions.
This happens sometimes, Lisa. People are just like, let's just,
Oh,
we got a question.
We do have one.
Okay, let's hear it.
How can you find closure when you have lost someone tragically?
So it's an experience. Okay. And while we're defining things, the first thing that I would do if somebody's asking me these questions is, you know, number one, what does closure mean? Okay. Does closure mean I'm going to never think of this person again? Is that something that you're after? Is closure mean, well, I'm completely fine with this person not being here? Does closure mean something completely different? To be realistic with it, and this is my personal opinion, but remember, grief is done as also is closure is also done, as is also, the experience of grief, a very individual thing. Okay. So I personally, for the things that I've grieved in my life, I don't want to just be okay with those being gone completely. I'm just going to use an example. I'd much rather the person be here, right? I don't think realistically I'm ever going to get to the point where I think of that person and go, I'm fine, they're gone, right? I want to remember their smells. I want to remember, the times that we had together. Okay. And I think and I don't mean any of this to sound harsh if this isn't how people view closure, but, I think people have to first question, well, what am I after here? You know, is it forgetting the person or is it remembering the good times? Okay. Because to me, closure could be, like I said, I get sad when I hear that song and a tear happens, and I might sit and cry for a bit on the side of the road. But then the majority of my time, I remember the good times that we had together. Okay. And I carry that person with me in all the new things that I'm doing. Okay. So I think it comes back to how are we defining closure? And I know it's hard to feel free to write back, whoever asked that question, because I know it's hard to have a conversation without having a conversation verbally. But I think it really comes down to that. And I don't think it's the type of thing, like I said, where there's a prescribed time or a prescribed way that you're supposed to find closure. It's how can I basically get to a point where I'm still going after my hopes, needs, dreams, desires, even though I've suffered some sort of loss here. Okay. And it depends on what the loss is. If it's a person, that might be different than a job. That might be different. Remember, we're talking about grief in a large picture. It's also going to be different if you're the one that's going through, in this case, we're talking about cancer. Is that a personal loss where the cancer's, at bay, but you might not be able to do the activities that you wanted to do because of your treatments? Okay, very different forms of closure and how we perceive them. And I think the first question is, okay, well, what are we after for closure? And I don't think we can just jump to closure really quickly. Okay. That also doesn't mean there's a difference between, remember how I said the pain of grief is the same as the physical pain of things earlier? That's what it grew out of in this class at Cancer Wellness. Okay. So there's a difference. It's another Buddhist saying, but we're going to hurt ourselves, right? So pain is inevitable. So the saying goes, suffering is optional. Okay. How can we change our experience of loss by what we're doing, not only in our mind and our body to, we can feel pain every once in a while. I can cry and feel the pain of loss. Okay. But what's the experience of suffering? Do I go on to suffer? And that's the first thing that changes as far as I'm concerned with grief. Okay. I don't think we skip it. I think that's something by and large, we start losing the suffering first, then the pain diminishes again. There's no steps. So hopefully that answers the question. but there is no ironclad answer of it's going to take 9 months and do these 6 exercises and call me in the morning.
Yeah, that was good. Um, we just got two more. One person asked, when doing the grounding sensory exercises, does it help to say things out loud rather than just in your mind? Which is better?
I would say it depends. I'm Mr. Depends right now, aren't I? So if you're all by yourself, and I would say to try it. It's sort of like people ask me a lot of times, is this better if my eyes are open or am I closed? And I always say, well, try it and see. It's going to be two different experiences. If we verbalize something out loud, okay, that's giving us a different experience because we're actually hearing the vibration or we're actually experiencing this word. Okay. One of my mentors, probably my most important mentor, his name is Paul Linden, and he's one of the iconic somatic people that deals in the trauma world. Okay. Was diagnosed, I think, 20 or 30 years ago with Parkinson's. Okay. And he's long outlived. He was supposed to have passed away a long time ago. Okay? And he's about to turn 80. And when you see him, he goes into tremors and that sort of stuff. But he's worked with all of this stuff. And we've actually been studying it because he can all of a sudden calm the tremors and all of a sudden be still for a bit. And then it comes out of it and everything. And one of the exercises he says is that he does and teaches people that are going through not only Parkinson's, but cancer and everything. He calls it frying the word. Okay. And basically frying like in a frying pan, you're taking the power out of the word. Okay. So when I was going through the thing with my wife and my son, I had a hard time, even though I teach all of this stuff, I all of a sudden to say the word cancer somewhere along the line, it was hard for me to even say the word. I would be like cancer. And it just came out of nowhere. Okay. And Paul and I knew each other and he knew me really well. And, he had me do a bunch of exercises where I was literally like, not only yelling the word cancer, but I was doing it differently. So, and it grew out of the exercise he did with Parkinson's. He said when he first got Parkinson's, it was devastating. He's a somatic educator. He's like, wait a sec, I'm going to lose control of my body. And like, what? And he was like, ah, he goes, and as funny as it sounds, he learned to say the word and he would practice this. He would stand up and he would say, Parkinson's. And he would like all of a sudden just like reframe this word, but he would verbally say it like he was happy about it. And it said, as goofy as it sounded, that experience of not saying, God damn Parkinson's, like seriously. And it was like, oh, Parkinson's. Ah. And it sunk in for some reason. And he's developed a bunch of different weird exercises based on this. And he did a few of them with me, with cancer. And it literally like the physical and not just the imagined saying of the word, but the physical experience of saying this word was a different experience and helped fry the power out of the word. Okay. So in that same vein, and I just tell this story for the experience of saying something out loud. Okay. I would say try it differently. I usually do it, and I teach it with people not saying it out loud, what they're exploring. But if you're working with somebody, sometimes it helps them because they're wondering, like, wait a second, am I thinking the right stuff? So I share, like I asked Lisa, okay, what do you see in the room? Okay, so I got to get, people thinking the right direction. And like a lot of other people do, Lisa gave me some visual stuff, but then was also describing the emotional side of things, right? And we don't want to get lost in the emotion. We want to know what's happening here. So I was able to quickly just say, okay, that's great. I love that. But let's bring it directly into like what sensorily what's going on here. Okay. So it depends on if you're helping somebody. If you're helping somebody, sometimes asking them to say it verbally a couple of times helps you lead them into that, like, oh, we're talking about a sensory exploration. Because people tend not to think that way. They, especially if we're talking about grief and emotions, we jump to the emotions because that's what's on our mind, right? And that's how we experience the room around us. We don't just experience it as stuff that we're doing sensorily. We also experience the room as Lisa said. Well, this is a great room. I love this room. And the emotions get brought into it. So hopefully that answered the question there.
That's great. And then someone said, um, I find myself revisiting my pre-op cancer surgery and crying, though I didn't cry or feel like I was processing at the time while in the moment.
Mhm.
What else can I do to make it a less intense feeling?
Okay. Okay. So just on the things that we did today, just so we can use some of these tools, that we're using. There's lots of different approaches, but let's keep it to what we worked with today. It's number one, that is completely normal and happens to a lot of people. We don't process everything right as it's happening. Um, Courtney, when you were reading it off, it's not only just cancer, but all of the different populations that I work with stress, fear, anxiety, trauma, pain, all of that. Um, a lot of times because of our distress responses, it doesn't happen all then. It happens later on. All of a sudden, all of these feelings and these rushes come back to us, and we're like cast back there. Just to give you some weird, crazy figures, you mentioned men healing. So, male identified survivors of sexual abuse versus females, the numbers are just about even. It's 1 in 4 women, it's 1 in 6 men go through this. And nobody thinks about that. But because of the stigma of if you're a man, you can't be raped. That couldn't happen to a man, right? But because of these feelings and everything, the average time that it takes for a man to say it out loud to anyone is 20 years before they tell anyone on average. And that's only the reported. And those figures of 1 to 4 and 1 to 6 are only the reported. So we all know that it's much more than that. Okay. So if we know that that's sort of a thing that happens when it just pops up later and down the road. Okay. First off, understand that that's a very common thing that happens. Now, along with that, there's a lot of stuff that's going on. Okay. We're projecting again into the future. We're definitely in the past, right? Because all these feelings are coming up. Okay. The strongest thing to ground ourselves is how do we ground ourselves in the present, not just through thinking. Okay, not just through telling myself that I'm here and I'm not back there. I have to prove it to my brain. Okay, we think we just say, okay, I'm here, and that's true. Remember, our body and our mind are trying to prove what's going on. That's why I said, how do you know what you're doing in your body? How do you know? Okay, we prove things to ourselves. Okay, a great place to start to answer your question is work on these grounding exercises. Okay, and first start grounding yourself in the present, like really know you're in the present right this moment. I'm sitting in this chair talking to Courtney and Lisa. Or not, yes, Courtney and Lisa. Okay. You know, um, I'm not 10 minutes down the road. I'm not, you know, a month in the past. Okay? That's the very, very first thing I start working with people is trying to experience what are you actually doing in your body right now, and where are you right this second, and now this second, and now this second, and that because they keep coming, right? Okay, so that's step one, but it's actually one of the most powerful parts because we're after that grounded feeling. Because from there we can try a bunch of other different things, but we're trying to get ourselves grounded. Any others?
That was very helpful. No, those were
Excellent.
all the questions. We've only got a couple minutes left. If anyone else has anything, please let us know. If not, I'll start going on my closing spiel.
And Courtney, if you want, I always tell people I have a very open door policy.
Mhm.
I know sometimes people are it's a little daunting to all of a sudden be asking questions in a thing. And I always tell everybody, I have a real open door policy, and it's write an email, send a text, whatever you need to do. I'd rather people just reach out. I have conversations with people all the time, without all of a sudden being officially a client or all of that. Myself and my family went through all of this. I'd much rather, and I volunteer lots of different places. I'd rather have a quick conversation with somebody just to let them know that people are out there, to help, like Cancer Wellness and myself and you doing this, Courtney. So definitely feel free to do that. So I don't know if you have my email or contact information, but feel free to type it in the chat or
Yeah,
type it in there.
absolutely.
I have a very open door policy, especially for people dealing with all this stuff, because enough people helped us along the route that I make that a priority.
Yeah, that's very kind of you.
Yeah,
Thank you.
absolutely.
Um, yeah, thank you both for being here. I really, really appreciate that. And this was really, really helpful. Not only to learn, but I feel like personally I gained a lot. So thank you for that. Um, our next webinar is going to be on June 25th, where we're going to have a speaker from Soul Survivors of Chicago, educate us on suicide in the Black community. And then we are having a family to family class start in the summer. You can find that information on our website, as well as, excuse me, I'm overcoming a virus right now. A family insight evenings are being held on the first Wednesday of each month. Both of those programs are open to family members who have loved ones living with a mental health condition. And then the first meeting of Try and Chat, which is a 3-part community conversation series designed for the South Asian community, is happening on June 10th. So all of that information can be found on our website as well. And then once you guys log off, a brief survey will pop up on your end. And if you guys don't mind filling that out so we can understand how you felt about today's webinar, and any additional information. And yeah, we really appreciate all of you guys being here, and we look forward to seeing you at the next webinar. Please take care of yourselves and each other. Yeah, thank you so much. And
Thank
thank
you
you,
both
Richard and
too.
Lisa, for being here.
Thank
Thank you,
you.
Rich. Thank you, Courtney. Have a
Absolutely.
great night.
Thank you. You
Yeah,
as well.
thank you.